Good evening, everyone. On behalf of the Veterinary Association of India, I warmly welcome you all to this special webinar on the occasion of World Veterinary Day, a day that recognizes the invaluable contributions of veterinarians towards animal health, welfare, and public health. This year's celebration reminds us of the evolving role of veterinarians, not only as clinicians but also as diagnosticians, researchers, and guardians of One Health. In the line with this vision, today's session focuses on ultrasonography in small animals, a highly relevant and rapidly advancing diagnostic tool that is transforming modern veterinary practice and improving patient outcomes. Myself, Libi S, student forum of RPS College of Veterinary and Animal Science, and I will be one of your hosts for today's session. Thank you.
So, good evening, everyone. I'm AswinRaj, a final year veterinary student from Rajiv Gandhi Institute of Veterinary Education and Research, Pondicherry. So, it's my privilege to introduce today's esteemed speaker, Dr. Chandrasekhar sir, M.V.Sc, Veterinary Gynecology and Obstetrics. Dr. Chandrasekhar sir completed his B.V.Sc from Hebal Veterinary College under KVAFSU University, River, and went on to pursue his master's in veterinary science in gynecology and obstetrics from the same prestigious institution. He is a university gold medalist and has also excelled beyond academics, earning the university blue and representing the national youth festivals held in Bhubaneswar and Rajasthan. With a strong clinical expertise, Dr. Chandrasekhar sir has extensive experience in soft tissue surgeries, abdominal procedures, and echocardiographic diagnostics. He brings with him 6 years of dedicated experience in small animal practice, reflecting both skill and commitment in companion animal care. Currently, he is serving as the head veterinarian at Dr. Dudley Pet Hospital, Elanka, where he continues to contribute significantly to advanced veterinary practice. We are truly honored to have him with us today. Now, I invite our Dr. Chandrasekhar sir to share his insights. Thank you.
Thank you, Dr. Ashwin. Good evening, one and all. So, welcome to our webinar on ultrasonography. This webinar has been specifically designed for young and budding veterinarians who are in their initial phase of small animal practice. And this webinar has been designed to create an impression that this ultrasonography is such a powerful diagnostic tool in saving lives. So, let's continue with the webinar. The contents will go something like this. There will be an introduction to the USG machine, a few things about nobology, animal preparation and workflow, basic procedure of abdomen scan, and all about report generation. To cut short, I want to make it a bit practical approach rather than the theoretical portion of the USG, what we have learned in our graduation. So I want to make it a bit practical approach so that it will be hospital oriented. This is the Varsana Active machine, GE Varsana Active machine, which I'm currently using in my hospital. And the probes will be arranged something like this. So coming to nobology, nobology is all about understanding the control of the machines. Within this, for a beginner, I want you to understand few of the controls here. Very first is the power button, which helps you to on and off the machine. And immediately once you are done with this, you'll be clicking this button, something called as patient button. So once you click this patient button, there will be a screen which will be like this. And here, mandatorily, you will be updating the patient details, the patient name, the age of the patient, and the gender of the patient. Once you're done with this one, you have to mandatorily check with the preset. What do you mean preset is all about a relation between your probe and the software. There are multiple presets like abdomen, obstetrics, gynecology, cardiac, vascular, urogenital, and followed by. So once you do this, your software also helps you to create a better image there. And once you're done with that one, you will be clicking this scan option so that you'll be proceeding for the scanning. And then the third control is your probe selection. we'll be having multiple probes, and each one will be having different uses. Maybe one for an echo, maybe one for an abdomen scan, maybe so for superficial tissue. Since we're concluding with this abdomen scan, we'll be selecting the microconvex probe. Once you have selected that one, you'll be checking on this. This is a trackball, similar to your cursor in your laptops. And then there is this button mentioned as 5, which will be helpful in increasing or decreasing the frequency. This control is all about gain. Once you take a help of this button, it will be increasing or decreasing the brightness. And now the gain is all about increasing or decreasing the brightness. Followed by this depth button, it simply means the zooming in or zooming out. Once you rotate this button, there will be zoom in or zoom out. And if you click on this button, there will be a small tilt in the angulation on the screen, which will be helpful to locate the area better. And once you have located a particular organ, for example, a bladder, you have to freeze this. And this button will be helping you to freeze the image. And once you have freeze, if you have to examine, maybe with the help of measurements, you can click the measure button where there will be multiple options. You can measure the area, you can measure the length, width, you can measure the volume, and multiple other things. And once you have measured, it's mandatory to save the image. So in this machine, in this USG machine, the P1 is customized for image saving, and the P2 is customized for short video saving. For example, you want to check a small blood flow, you want to check a small movement of the intestines, or maybe urine falling within the bladder. This button will help you to save that fraction of video. There is some other button called as color flow. If you want to see a fluid passage within a greater vessel, a blood passage within a greater vessel, you can click this button so that will be showing a passage of fluid within any of the vessels. So there are other two options, something called as dual and quad. When you click this button, the screen will split into two for a comparative study. And when you click this quad, the screen will split into four for a comparative study. Generally, this will be used in echo parameters. And one more button, something called as TGC. I explained you about this gain. Whenever you are using this button, there will be increase in gain or decrease in brightness. For example, you want the image to be centralized and the area surrounding that to be neutralized. So if you just take it to the right side, it will be brightened, or if you just take it to the left side, it will be shadowed down. So with respect to probes, we have wide variety of probes. Starting from phase array probe, this will be used for an echo cardiac scan, a linear probe, which will be helpful for superficial tissue scanning like mammary glands, tumors, lymph nodes. Microconvex probe, this will be helpful for your abdomen scan in small animals. There are convex probes, convex array 4D volume probes, and transvaginal probes, most possibly for large animal sector. So these are the probes that I'm currently using in my small animal veterinary practice. So the first probe is your microconvex probe, which will be emitting a frequency from 6 to 10 megahertz. The phased array probe, which will be emitting a frequency between 3 to 4 megahertz. And the linear probe, which I use for superficial tissue scan, which can give a frequency of 8 to 13 megahertz. So let's dive into the actual body of the webinar. So I just want to let you know how does the USG work. Basically, this USG works on piezoelectric effect. The principle itself is piezoelectric effect. To be very simple, we will be sending a wave through a tissue, and this wave will hit at a particular point, and this will come back. Whenever it is coming back to a particular point, the point is the same point where we are ejecting the waves, and hence from here it will be converted into electric signal and the sound waves are formed. So to know about ultrasound, this ultrasound is actually a high frequency sound which are more than 20 kilohertz. But for veterinary use, we are using a frequency between 2 to 15 megahertz. So as shown in the image, whenever an if you can see this probe, At the tip of the probe, there will be a layering of piezoelectric crystals and which is supported by a backing material. And to this, the electric current wire will be connected to flow the electric current. Whenever we flow an electric current, this current will help to vibrate the piezoelectric crystals. And whenever these piezoelectric crystals vibrate, there will be formation of ultrasound waves. And once you are putting this probe on the tissue, these waves will be traveled. And when, however, the denser and how denser the area, they will reflect back. And the same piezoelectric crystals will collect these waves as a reflection. And here onwards, it will convert into electrical signals. And by the help of the software, which will be converted into a real-time image. This is how an ultrasound works. So in basic, you have to understand two things within ultrasound. It's all about echogenicity and echotexture. To say echogenicity, it refers to the ability of a tissue to reflect ultrasound waves. Echogenicity, it's all about generation of echoes, which is nothing but a reflection of waves. So within that, we have multiple things. Something called as hyperechoic. For example, if the tissue is way too denser, the sound waves will hit and come back, and which will be giving a brighter image. For example, with fat, fibrous tissue, and mineralized tissue, maybe bones also. Isoechoic, you're concentrating on a tissue which is a different tissue, but surroundingly you are concentrating a different tissue. Both the tissues are giving same echogenicity, which is something called as icoechogenicity. For example, whenever you're scanning the liver, the surrounding muscle tissue will be compared. So this will be giving the same echogenicity. And if the tissue density is way too low, this may give a very little echogenicity, which is something called as hypoechoic. And many soft tissues, some tumors will give you this echogenicity. For example, the wave is traveling and it is not at all reflecting back into a media, from the media where the waves are not reflecting back and it is passing by, it is losing its energy. So then there won't be any echo formation. It is something called as anechoic. Generally, your luminous structures, something like a bladder, gallbladder, will give you this kind of echogenicity. So it is always described that echogenicity is relative to another organ. Likewise, the kidney cortex is a bit hyperechoic compared to your urinary bladder. And the liver is a bit hypoechoic to your spleen. This is how the echogenicity works. In contrast, ecotexture, it is all about the internal pattern of the tissue. It refers to the uniformity or pattern within the tissue. It may be two things, either homogeneous ecotexture or heterogeneous ecotexture. What I mean by homogeneous, it is all about uniform and smooth pattern. What I mean by heterogeneous, it's all about a differed pattern, maybe a mixed pattern, where you'll be getting from the same tissue. You'll be getting some echogenicity, which is hypoechoic, maybe admixture of the echogenicity. That I can tell as heterogeneous ecotexture. In general, your abdominal organ like spleen, liver, they give a uniform ecotexture, something called as homogeneous ecotexture. If they're losing this ecotexture, there may be an abnormality. So if I come to organ-wise echogenicity, in this hierarchy, the fluid things will be completely anechoic, starting from the bladder, it will be anechoic. Then to the kidney cortex, it should be a bit hyperechoic compared to the bladder, and the liver, which is more hyperechoic compared to your kidney cortex, and the spleen comes later, and at the end, it should be more hyperechoic, that is the fat. This is the hierarchy within the echogenicity. So coming to transducer orientation, it's all about how you hold a transducer or maybe the probe. And see, if comparing this as a transducer, there will be a pointer at the tip of a transducer. And always this transducer tip should be matching in the screen and that it will be displayed. So like this, the transducer tip will be pointed within the screen. For example, if you are placing at the caudal part on the abdomen and you are sliding into the cranial part, the pointer is also in the screen, the pointer is also moving towards the caudal to the cranial. This is all about transducer orientation. There are some transducer manipulations. For example, I'll be just going with a practical approach here rather than giving a lot of theory here. So once you place it on the abdomen, for example, we're keeping it above abdomen, the pointer is always placed towards the cranium or towards the head of the pet. And if you are moving from caudal to cranium, this is something called as sliding, going front and coming back. This is something called as sliding. In the same way, if you are going perpendicular, this is something called as sweeping. So this is all to make sure that you are locating different organs and different structures within the organs. And for example, if you are keeping the probe on the same point and you are rotating it from that 90-degree position, this is called as rotation, which is one of the manipulation. In the same position, if you are moving the 90-degree angle, if you're mobilizing like something like this is called as fanning. All these things are actually required when you're doing an abdomen ultrasound to locate a particular ends or maybe the center of an organ. So, coming to the purpose of abdomen scan, in common practice, the common indications are something like whenever the pet is vomiting, just to make sure the gastric lumen is it regular or irregular, to make sure it is having some ulceration or some foreign body in the abdomen, maybe an intestinal foreign body, to check the motility of the intestine. Whenever there is an abdomen pain, we also go and check the pancreatic size or whether they are inflamed or not, and suspected organ pathology. Maybe if you have taken a blood test where your liver-related enzymes or the kidney-related enzymes, the gallbladder-related enzymes are way much increased, then you will be pointing out on the organ. And whenever there is a distension, something like an ascites or maybe an abdomen distension which is way too hard, suspecting a tumor, will be proposing for an abdomen scan. And this abdomen scan, these ways are basically very safe and they're non-invasive in nature. Recently, we are using this abdomen scan as a means of physiotherapy too. So I just, in the starting of the slide, I told you we just want to make an impression that this ultrasound is actually a very powerful tool to save the lives, you know. So I'll be giving two case presentations before going to the actual ultrasound abdomen scanning procedure. So in our hospital, we got a Rottweiler, somewhere around 3 years of age, and it was presented with lateral recumbency, completely stiffened limbs, and with a history of continuous seizures over the last 6 to 8 hours. On day one, it has been presented to some other hospital where the temperature was high and they have been treated for pyrexia. And in the day two, they have gone for fluids, but unfortunately, they couldn't have gone for blood test. On day three, they have presented here, and it is having a severe seizures. Animal is already recumbent. In general procedure, if a case is presented with history of seizures, we have to go with anti-epileptic drugs followed by blood work, and then we'll decide how to proceed here. In general, whenever the animal is low, I'll be going with this blood glucose evaluation. Shockingly, it was just 16 mg per day. And to conclude here, we'll go with differentials, right? On that day, the blood work was about to take some 2 hours. Okay. So considering this blood glucose levels, I had to correlate with hypoglycemic seizures. And this hypoglycemic seizures is always correlated to pancreatitis. And I suspected pancreatitis, went for a scan. Unfortunately, I got a highly inflamed pancreas. So considering as suspected, it is a pancreatitis. But yes, to mediate this pancreatitis, there will be some multiple origins. Meanwhile, when scanning, I got a very big spleen which was completely inflamed and there was a splenomegaly. Immediately convinced the owner for about blood test and we sent it. There was anemia, thrombocytopenia, and PCR confirmed Ehrlichia canis. So at the end, we got a conclusion that Ehrlichia canis was causing a lot of inflammation and liver dysfunction. This also, because of the toxic effect, this also has caused the pancreatitis there. So thereby, for the next 24 hours, the glucose, whenever you put the D25, the glucose is to go high and it will be rapidly falling down. So here, over the first 36 hours, we managed the hypoglycemia and the pet came back to life. So this is how your ultrasound will help you to shorten and fasten the diagnosis. In one of the other case, by name Goldie, it was actually a golden retriever. It was having a history of constipation, unable to pass some stools. It was having a history of constipation. One of our vet treated it, and he gave some laxatives. The pet passed the motion. It was having a bit abdominal discomfort. the with a discussion with us, the owner also wanted to go with barium contrast as we suggested them. So once we're going with barium contrast, we keep the pet for at least next 24 hours, since you're taking a barium contrast X-ray every 8 hours. And after the second X-ray, there was after 16 hours there was nothing in the abdomen. But shockingly, the animal peed a lot of yellowish urine, and the temperature was actually normal till then. So just out of concern, I took it for a abdomen scan. Basically, in the practical approach, if a pet has been presented for something which is related to GI, you can't directly ask a pet parent to go for blood work immediately. So I went for a scan, and here we diagnosed splenomegaly again. So since there is a proof here, I mean, within the when you do a scan, you will be getting a picturized proof, and with this picturized proof, we convince the owner this could be a relation, and the owner convinced. We sent the blood sample; it was positive for Babesia. So this is how the treatment was done. And we think, what if we could have not for a, we could have not gone for a scan and would have waited and discharged the pet. This is how your ultrasound helps you. And again, the same case of splenomegaly, a Indian pet presented for a mismating confirmation. It has been mismated some 32 days ago, which was presented for pregnancy diagnosis. Unfortunately, it was actually got pregnant, but the spleen was also, enlarged in this case, and convinced the owner to go for blood work. And the same thing again, it was also positive for Ehrlichia canine. Started on doxy irrespective of anything, and the pet just littered some 2 weeks back in the same way within our hospital. So this is how you can use an ultrasound tool. Uh, Rather than to make a delay, it can be a faster approach. So this is all about the ultrasound usage. Coming to patient preparation, you have to clip the whole of the abdomen. If even though if you are going for just bladder scan, I would suggest you have to scan the whole of the abdomen and all the organs possible. So we'll be clipping the whole of the abdomen, and we'll be using a coupling gel. Before we start your scan, we'll be using a coupling gel. This coupling gel is basically scanning gel, which helps as a conduction media to make sure this waves will be passing easily, and there won't be any disturbance with the help of with gas bubbles or not. This will remove all the barriers possible outside the tissue. So with respect to placement of the pad, in general, it is always suggestive to be dorsal recumbency, but in practical approach, most of the pet will be reluctant to go with dorsal recumbency. Either ways, you can go ahead with some opioids like buterfanol during the time of examination, which will give a better relaxation. And however, in beginning, we'll be manipulating a lot on the abdomen, which shouldn't cause a lot of stress on the abdomen too. Either ways, you can go with one other approach, lateral recumbency. You can go ahead with scanning, and once you're finished with the maximum organs, you can shift the pet on left lateral recumbency. This is how I generally practice here. So with the workflow, there'll be a lot of disturbances when you're starting. I mean, you'll be keeping the ESG machine in front of you, and you'll be trying to focus with the help of your left hand. Uh, Here within my hospital, I keep the patient towards my right hand side with a right lateral recumbency. I keep the ESG machine in front of me, and I handle the controls with the help of my left hand. And most of the times, I'll be choosing a room which, when you're switching off the lights, it can be as dark as possible to get a better images in the scan. And I would always recommend to use a safety gloves before you go for, when you're going for scanning, which is to prevent a lot of zoonotic diseases, typically these leptospira and all. And I would always suggest you beginners to use mask. What happens, whenever you're going for trimming, may not be in dogs. When you're going for trimming these fine hairs of cat, you may get a lot of dust allergy. So this will be a preventive measure. This is all about the workflow. So coming to the procedure of scanning. So generally, I want you to start from caudal end to the cranial end. In the caudal end, near to the pubis on a dorsal recumbency, if you are placing a probe, you will be first locating the urinary bladder. This bladder is generally anechoic lumen. So you'll be first diagnosing this urinary bladder. Followed by that, if you can locate the trigone there, or followed by that, if you can locate the urethra, you can also locate the prostate gland within male dogs. Otherwise, if you just go anterior, fan a bit cranial to the bladder, you'll be getting the uterus. But the thing is, only a pathological uterus will be enlarged, or maybe sometimes a pet which is in estrus, you can see a fine line there. Once you have located the urinary bladder and the prostate, you can sweep. As I said, there are a few things of manipulations: sliding, sweeping, fanning, and rotation. Once you are done with your bladder and prostate gland, you'll be sliding a bit anterior towards the lateral side of the pet. And if it is in a lateral recumbency, right lateral recumbency, left side of the body will be upper side. You will be noticing either the kidneys, which is the left kidney. You focus the left kidney and you freeze the images, and then you'll be getting a splenic tail. If you slide a bit anterior, you'll be getting a splenic body. A bit sliding towards the cranium and fanning there, you'll be getting the splenic head. Followed by that, in anterior to that, you'll be getting a stomach, and then you can focus from the left lateral lobes of the liver, left lateral, then in between you'll be getting the gallbladder, and towards the right lateral lobes of the liver. And when you're coming back, you can also focus the right kidney. Meanwhile, if you are already practicing, you can also focus you can also focus the pet's adrenal glands. And if you have a better exposure over your USG, you can start focusing the stomach. I'll be showing the images of the stomach in next slides. And you can trace out the stomach followed by duodenum, smaller intestines, and larger intestines. This is how, in basic, you have to go for a scan. So when you scan an abdomen, the urinary bladder will be anechoic lumen. If you tell the echogenicity, it will be anechoic followed by a thin layer. This is a normal urinary bladder. When it comes to some abnormality, you can see a lot of, in this, you can see a lot of thickened and irregular wall, which is something called as cystitis. There has been an inflamed wall of the bladder. You can also measure this bladder wall. And in this picture, you can see a lot of sludge within the bladder, which is an abnormality. And here comes a normal spleen, which looks like this, and a severe splenomegaly. In stomach, if it is a normal stomach having some food contents, it can give a image something like this. Or if it is a stomach which is completely empty, or maybe having a bit inflamed mucosa there, considering gastritis, it can show you like this. Basically, these are the images you can get with the microconvex probe. But this is an image which has been got by a linear probe. You can see how beautiful are the ruges. It is a cat abdomen, and this has been taken with the help of a linear probe. Normal intestines will be looking something like this. This is an image taken by a linear probe. What you can see is an interception image where you can see this kind of structures, a bullseye appearance within the abdomen scan. But it is preferred that you go for a linear probe to get these kind of images. You can differentiate the layers of, if you use a linear probe, you can specifically differentiate the membranes of the intestine, or the walls of the intestine. So this is how a kidney looks like looks in a USG. So what you have to demarcate here to say it has a normal kidney, this is the external layer, which is the cortex, and this is the internal layer, which is something called as medulla, which is hyperechoic and hypoechoic. If there is a difference in the echogenicity, you'll be getting a barrier there, or a demarcation layer. What we say it as a CMJ detail, corticomedullary junction detail, or corticomedullary junction differentiation. If a pet which is having CMJ details normal, then structurally the kidney is almost fine, and then you can go ahead with a color flow, Doppler color flow, to evaluate the perfusion within the kidneys. You can measure the length and width of the kidney, and if you can measure the length of the kidney and compare with the aortal abdominal aorta diameter, you'll be getting a normal ratio to say whether the kidney is having a normal size as per the breed or the body weight, or it has been gone atrophy or hyperplastic, or maybe some inflammation there. So in this image, you can see a kidney where you have the kidney corticomedullary junctions are completely lost. This is again a microconvex probe. This was actually a pet called as tofu, which was presented with the help with the history of vomissions, and this loss of CMJ detail is attributed to renal dysplasia. It was just a 3-month-old pet, which was not at all having any CMJ details, and the kidney size was actually smaller, which is not getting developed more. This is how we can differentiate between a normal and abnormal kidney. With respect to the liver, this is a normal image of the liver. When you put some color Doppler flow, you'll be getting the hepatic portal veins like this. Within the gallbladder, again, just like a lumen, it's a lumen which is having some anechoic fluid with a thin membrane. You'll be locating, when you're coming from the lateral, left lateral portion of the liver, you'll be getting this gallbladder, which is a normal gallbladder. This image is a normal gallbladder image. And in this one, you can see a lot of sludge form within the gallbladder, which is a pathological thing. So this is a fine image of an ovary, basically, which is a canine on cycle. So on a different image, we have measured since they were measured equally, and after a repeated scan, they actually regress. They actually regress, so that we consider them as follicles, which are multiples generally in canines. Either ways, if you just miss an angle, something like this, you will be confused with some tumors or maybe cysts. So I want you all to take a small screenshot of whatever I'm presenting here. So just keep this image saved, and you can either text back what exactly is the image, what you're seeing. This is an ultrasound image, an abdomen image, and canine abdomen image. I just want to text back there what exactly this looks like. This was a very big pathology within the abdomen. So after all this, I think this is more than enough for beginners. After all this, with respect to the documentation, there should be a structured reporting format. It should be organ-wise findings. Always, we have to attach representative images with annotation, but it is not mandatory also. It is decidable again. And you have to give a summary and impression of the clinical correlation. Whatever you have found, you have to mention within the report and give a conclusion for the report. With respect to this reporting format, I have prepared my own reporting format where I'll be mentioning the header as my hospital's name. And within this, you'll be giving name, I mean, details of the pet name, species, breed, age, sex, date of examination. Sometimes there will be a colleague who will be referring you this case so that you can add his name as a referring clinician for the data. If at all there are some history which is typically taking your ultrasound as a diagnostic measure, you have to indicate there maybe vomiting, diarrhea, loss of weight, abnormal lab values, or you might be getting some mass upon palpation. In imaging protocols, you will be mentioning whatever, if you are measured with the longitudinal views, transfer views, whatever you are using, you'll be mentioning there. Generally, I use all the possible things, including the 2D and Doppler things. At times, we'll be using sedation. Most of the times, we avoid. At times, we will be using the sedation. If you are using it, take a consent and you can mention. It is a bit mandatory to mention the status of the bladder so that it will be very much confirmative to analyze the report there, whether it is completely full, partially full, or empty. So when you come with organ-wise findings, my reporting system is something like this. I'll be going with the wall. I'll be mentioning whether it is normal, thickened, or irregular, and I'll be mentioning the measurement of the bladder wall. With respect to the contents, I'll be mentioning whether they are anechoic or if they are heterogeneous, I'll be mentioning sediment, mass, or if I find some calculi which is giving some shadow, I'll be mentioning the same. And at the neck, if at all it's a male cat, a tomcat, which is having some obstruction, if you look at that, you can also mention there. At times, you may find some TCC mass developing also. You can mention the same abnormal pathology. Likewise, in kidney, I'll be mentioning the size of the kidney, comparison of the length of the kidney with the aortic diameter, that ratio, the CMJ details, whether the renal pelvis is dilated or not, to say whether it is hydronephrosis. Ureters, if they are visible, you can mention, and renal masses, if any. Generally, you get a lot of polycystic kidneys in case of cats if they are already inbred. In spleen, you'll be mentioning whether the splenic size is normal or not. You'll be measuring if it is going beyond 2 or plus. You'll be telling it as a splenomegaly related to your hemoprotozoan diseases. Ecotexture, if it is homogeneous, it is normal. If it is heterogeneous, there may be a tumor there or mass. Cyst abscess can be noted there. If you find some lesions, basically these are organs which are highly prone with tumorous masses like liver, spleen. So you'll be mentioning whether there are some nodules or masses. In stomach, you may have to go ahead with your linear probe to visualize better. Um, Always, I suggest a patient to be presented if they're coming for a generalized scan, ask them to come under fasting, which helps in two ways. In the abdomen, the stomach will not be disturbing a lot of other organs. It will be very much shrunken, and there won't be any disturbance from the gas within the intestines. So you'll be mentioning about the wall thickness, whether they are normal or thickened in case of gastritis or irregularity in case of gastric ulcers, wall layers, whether they are preserved or not. Motility, you can assess the motility at the end of pylorus, whether they are motile or not, or if they are stagnant or whether they are having some hypermotility. So any masses or contents within that one. If you find some foreign body, hard foreign body which is giving some shadow, you can mention the same. In liver, you'll be mentioning the size. Typically, you will get microhepatica. You can mention easily because where the liver size will be very much shrunken. Ecogenicity, you will mention as either normal or increase or decrease, homogeneous or heterogeneous ecotexture there. You'll be mentioning the margins of the liver, whether they're smooth or irregular. If you have found any multinodular patterns, you'll be mentioning there. And then going directly to the gallbladder, I'll be mentioning the wall thickness of the gallbladder and any contents within the gallbladder, any obstructive phase, severe distension or not. This much I'll be mentioning in the reports. If at all you are expecting some clinical signs with respect to the pancreas, you'll be getting pancreas inflamed. You can mention the vascularity, which will be a bit more in case of pancreatitis. Either they are inflamed with respect to size, it will be increased, that you can mention. Within intestines, most of the pathologies, you can find a lot of diarrheal material within the intestinal lumen. A lot, whenever there is an intersection, there will be a lot of contractions nearby in a single phase. And you can also mention about the motility, whether it is hypermotile or hypomotile. You can mention about the contents, whether like a foreign body, like a forming stools, a hardly formed stools, something like that. Uh, if you have practiced enough, you can also locate the adrenal glands. Pretty much easy in case of dogs. Um, Most of the things which is related to your hyperadrenocorticism, whenever you're getting a dog which is having a very thin skin and being treated for a longer time and has a history of licking a lot of steroidal ointments or maybe has been treated with steroidal things, there may be a chance of hyperadrenocorticism. And how do you diagnose this? The first thing you can go, it's a very non-invasive procedure. Directly you can go ahead to an abdomen scan, locate the kidneys. Anterior to that, you can focus enlarged adrenal gland. Lymph node, maybe lymphosarcoma, or maybe a severely enlarged lymph node, or maybe in case of lymphosarcoma, you can see if it is a lymphosarcoma, for sure you'll be getting a leopard kind of leopard skin pattern spleen, which is a conclusive thing for lymphosarcoma. With respect to peritoneum and mesentery, whenever you are getting some ascites case, you have to mandatorily update about this one, whether you are finding some fluids there or not. Whenever there is pancreatitis, you have to mention the hyperechogenicity of the surrounding mesentery. In reproductive organs, if it is a male, you'll be giving the pathologies of prostate. It may be a hyperplastic prostate tissue, maybe cysts in it, abscess sometimes, or maybe a benign prostatic hyperplasia, which is gone already tumorous. In a female, it will be giving ovarian pathologies like ovarian tumor or cyst, uterine pathologies like pyometra, at times cervicitis too. If at all you're finding if you're finding anything other than all these things, you can mention in as an additional finding. So all these, in a conclusion, maybe in a paragraph, you have to give all the respective changes like cystitis, microhepatica, hepatitis, inflamed liver parenchyma, lots of CMJ details within the kidneys. All these things you have to prioritize, highlight them, and give it in the form of paragraph, which will become your interpretation and summary. And at the end, within a single line, you give your impression what exactly it is, just like cystitis, microhepatica, or all other changes. And in the end, you can say few other organs like stomach, like intestines, they are normal. This gives like an impression. And based on whatever you have seen, you can recommend something. For example, if you have seen pancreatitis, you can suggest for canine pancreatic specific like lipase for a correlation. If you have seen a tumor which is non-conclusive, for example, a tumor within a gallbladder, which will be very much non-conclusive, it may be a thick mucus, it may be a thick mucus, it may be just a sludge, it may be a tumor there. For a confirmation, you can send it for a CT or MRI. And FNAC or biopsy, for example, you're suspecting some splenic abscess and the patient is not still in a critical phase and you can't approach it immediately. For a confirmation, you can go ahead with ultrasound guided FNAC, or you can take a biopsy also with the help of biopsy pens. If you want a repeat scan, for example, if the case is presented for severe cystitis, including crystalluria and sludge, you want to go ahead with the repeat scan, whether you whatever the prescribed medications are having a specific action or action on it or not. So you can choose repeat scan. And for example, if you're getting some pathological conditions like pyometra, splenic abscess, severe splenic tumors, cystoliths, gallbladder liths, you can directly go ahead with the recommendation of surgical consults. And if you are having some non-conclusive things, you can also relate with the radiograph there. And at the end, you have to mention your name, your designation, and the date of scan. So some of the practical tips for beginners, I'd always suggest always start with the default abdominal preset when you're checking. Even though you may be in a hurry for abdomen fast, A fast, you always preset there. This will help you a lot in customizing the frequency, the wavelength, just with the help of the software itself, and for producing a better data. Adjust the grain, which is brightened, and the depth first, which is something called a zoom, for a proper focusing of organ. And then you can go ahead with fine tuning with the help of time gain compensation. You always keep the probe steady. Do not pressurize the abdomen so much. Generally, you'll be pressurizing whenever you're going towards the right kidney. You may have to put a lot of pressure. Try to avoid, and which may help in distorting the organ if they're very much fragile inside. And it is mandatory to save the representative images with annotations for each of the organ. So again, whenever it is a hospital setup, it's not just about diagnosis and leaving the machine like that. You have to take care of the machine. Your mentors or you maybe have been invested a lot in this. If I say ESG machine costs somewhere between 15 to 35, sometimes 40, 45 lakhs together. So you have to take care of the machine so that whatever you have invested should come back also. Here you can see I have covered all these probes with the help of baby socks so that it will prevent a lot of wear and tear on the piezoelectric crystals there. Once you're done with the scan, it is mandatory your paravet will be cleaning with the help of dry tissue. None of the, not even a small quantity of your coupling gel should be retained. Once you leave that, there will be that coupling gel will become hardened and it will cause a lot of corrosive effect there. And you have to cover your ultrasound with the help of a towel after the scanning is done to prevent some dust related issues. Often, maybe once in 15 to 20 days, you may have to open this thing, which is a trackball, where you can find a lot of small, minute hair trap. So you have to keep on checking this one. And once your scanning is done, always blow dry your ultrasound with the help of a hair dryer. These are the practical things which you have to do to take care of your USG machine. Then your USG machine will take care of you. So I want to be thankful to my mentors, to Dr. Lohita HD, who is the president of PPAK Bangalore, and Dr. Venkatesh J, my teacher for ultrasonography. Currently, he is the founder of RO Pet Hospital in Chennai, and Mr. Yash and Mr. Utsav, founders of Dr. Doodley, where I'm currently working in. Dr. B.M. Patil, my senior vet, who is a surgeon working in Maruti Pet Care. And all with the help of all these mentors, I have been gaining a lot of knowledge here, and it's making my practice way too easy. I want to thank a lot. I want to thank a ton to Veterinary Association of India, who gave me a chance to present this webinar, and also VetNet for hosting this one. And again, I want to give some special thanks to Mr. Basavraj, Mr. Libi S, Mr. AswinRaj S, doctors, and Bhavna. Thank you so much for this one. So thanks for all your attention, all delegates here. Currently, I'm working as a head vet in Dr. Dooley's Elanka. For any kind of questions, you can either email me, and the email has been given there, or you can DM me with this Instagram, and I'll be available at Dooley's Hospital Elanka. If you have any questions, you can text to the host there, and it will be reflecting to me. And that's it. Thank you so much.
Thank you for the wonderful session, sir. It was very practical, and for beginners like us who are pursuing final year of B.V.Sc, who have just passed out, uh, who have less exposure to ultrasonography, because for in undergraduate level, the exposure to ultrasonography is a bit less. So, with starting even from basic procedure from each explaining the each switches of the ultrasonography machine to detecting different pathology. You have explained everything in very nice manner, sir. From on behalf of Veterinary Association of India, I would like to thank you for this, sir.
Thank you. So if you want this format, I can send you, if you can DM me or email me there, I can send you this scanning format. Maybe one lacuna we have within ultrasonography, it is always a practical approach, like a workshop approach. If I get a chance, I can show you I can demonstrate you how exactly I go with the probe movement with the help of probe modulations there. Maybe in future, in near future, we may get a chance to host a workshop for ultrasound. Let's see, and hope the delegates here will also come and join us there.
Sure, sir. I think you have a few questions here left, sir.
Sure.
So, one question is, how is ultrasonography useful in guiding fine needle aspiration or biopsy procedures in small animals?
For example, consider this as a probe. You will be holding this in your left hand this time. So once you're placing the probe, for example, I have to collect a tissue from the screen which is having some heterogeneity there. Once I have gone with the scan, I have found that some heterogeneous ecotexture there, or maybe a complete anechoic thing there. It may be a cyst, it may be an abscess, it may be tumor there. So what you will do with the same probe under sedation, with the same probe, you will be focusing the organ, and there will be longer needles which are generally used, something called as microtome kind of needles. So which will be placed something like this, and the needle is always seen in the screen, and once you go there, you'll be just having a click which will collect a bit of sample there. Either ways, if it is fluid kind of pattern, you can use a longer spinal needles there, directly go there and collect a small amount of sample which is a bit invasive, doesn't cause a lot of damage to the tissue.
The next question, sir. How can adrenal gland abnormalities be detected using ultrasonography?
Uh, Pardon? Repeat again.
How can adrenal gland abnormalities be detected using ultrasonography?
See, in general, we do get a lot of adrenal gland, right? We do get a lot of skin-related thing, which is hyperadrenocorticism. Within hyperadrenocorticism, your adrenals may have been severely enlarged. Generally, if you locate a kidney, it is very difficult to locate your adrenals. But if it is for sure hyperadrenocorticism, the adrenals will be massively big. Immediately once you are focusing the kidney rather than the kidney, the whole of the picture will be gained by your adrenals. So this hyperplastic tissue, the hyperplastic tissue which has been enlarged, is detected there, and you can conclude as an hyperadrenocorticism.
Okay, sir. I have another questions. So, with the help of this colored view, that is a Doppler, so what are the pathologies we can detect, and in which case we want to apply that Doppler?
Correct. A very, practical question. Maybe this has been asked by some practitioner itself, maybe my initial practitioner. For example, I might have received a case which is related to the kidney. In the blood, the pathology shows, the biochemistry shows the elevated creatinine. Now, you consider the age is somewhere around 6 to 7 years. It may be a cat or a dog. You consider between 6 to 7 years. And with with treatment, it is not getting better. Now you have to give a prognosis. If you are not giving any conclusion within first 48 hours, the owner will do a lot of damage there. So you have to conclude there, and you should get a conclusion. How will this prognosis grow? So what he will do, he will again check the kidney there. He will check the kidney there. He will go ahead with CMJ details. If the CMJ details are blunt, you apply this color Doppler flow. So what in general, this kidney will be getting a lot of blood flow through the hilus, right? You have to track this hilar blood flow. If this blood flow is getting very much narrowed down, that means the tissue perfusion, I mean the renal tissue perfusion is very low, and it is considered as a chronic renal failure there. And at tumors also, not just with the kidney, any tumor which is originating from any of the organ which will be having a direct blood supply, and any tumors which will be highly vascularized. Once you put, if you are getting a structure which is having a heterogeneous ecotexture, directly apply your color flow, and if it is having high vasculature, for sure it may be tumorous there. That's it.
Okay, sir. Thank you. So, same
and
thing
and
applies to for each organs, right? Depending
sorry.
upon the same rule apply for each and every organ. Depending upon
Correct,
the blood
correct,
flow,
correct.
we can,
Yes,
if it is having
yes.
more blood flow, we can take it as a tumor or inflammation. For inflammation, what we can see there in Doppler.
Generally inflammation, the echogenicity will go low. See,
Okay.
to rule out all these things, you have to practice a lot. And once you do a multiple scans, maybe 1,000 scans together, you'll get to know a normal echo texture of a organ. And there onwards, on a continuous practice, if you see a hypoechogenicity, there may be an inflammation. How do you get an inflammation? With surroundingly, there may be a fluid filled thing. So you can consider that as an inflammation. To some extent, your color flow will help, but it is not actually a perfect tool to just rule out inflammation.
Thank you, sir. Sir,
Yeah.
then you have given a question regarding that abdominal USG. That is,
Any answers on that?
no, sir, we didn't get any reply regarding that.
Any funny answer on that? At least maybe like it looks like a human baby or something like that.
Actually, myself, I feel like it is like some fetus, I can say.
So, unfortunately, it was a very big diagnosis. It was a very thick mucus which was in the gallbladder. The gallbladder was distended at least 15 times than the normal gallbladder size. You can see the orientation. Then, I mean, gallbladder which should be seen circular in the USG, which has been elongated, and which is actually a very thick mucus blocked in the gallbladder. I have a lot of images like that. I could have shared because it is a basic session. I didn't want to confuse the delegates here if they're early practitioners.
Okay, sir. In another subsequent sessions, we can advance our information, I think.
Sure, sure, sure.
Okay, sir. Okay, sir.
Okay. If
Once again,
delegates have any doubts, they can directly DM me, and I'll be sharing this to you. Kindly share to all the delegates this USG format, report generation format.
okay, sir. On behalf of once again on behalf of Veterinary Association of India, I would like to thank you for sharing your valuable insights in small animal ultrasonography, sir. Really, this session will be would be informative for all the students, practitioners who have attended this. And I would also like to thank the platform VetNet for conducting such webinars in association with the Veterinary Association of India. So in future, we are expecting more informative sessions like this, and with good speakers like our sir, who it was not even like a theoretical; it was pakka practical, and the time engaging the 1 hour it went very swiftly.